Good morning, everyone. I am going to have a minute to let everyone come into the room. And then I will open in a minute. So as everyone just settles, we will sit together on this International Day of Peace. And Liliana, can you see as people are coming in?
Yes.
Okay. Will you give me a signal to when you think I should start? Because I can't see that.
Usually, we can wait maybe a minute and a half. There's 59 people who have joined in. So
I'll give it another 20 seconds or something. Okay.
Right.
I just got a message from Father John saying he's failing to connect. So I'm not quite sure what to do. We'll just start.
I think we'll start now. Yes.
Okay. Happy International Day of Peace, everybody, and welcome to this global webinar. My name's Dr. Catherine Pettis. I'm the Senior Advocacy and Partnerships Director of the IAHPC, an organization whose vision is a world free from health-related suffering. Palliative care is, in many ways, a practice whose aim is to bring peace to patients and families who are suffering through serious illness. And in fact, a palliative care doctor once told me that palliative care should possibly one day get the Nobel Peace Prize, because that's what our mission is. So we're grateful to the moderator, Dr. Dingle Spence, who's joining us today from Jamaica, and to our esteemed panelists joining us from Birmingham and San Diego. We're waiting on the colleague from Zambia, Father Damascene, Father John. Dr. Spence will introduce them when she takes the floor. So give me a minute to share my screen so that I can begin introducing the topic for today and the International Association for Hospice and Palliative Care. So,
Catherine, if I may, sorry to interrupt, I just placed a note on the chat box. If anybody has any questions, please use the Q&A tool.
Yeah. Okay. I have a housekeeping slide to remind people of that. So we'll do that. And everybody check the Q&A for our website and then put any questions in the chat, please. And the other panelists for a minute can turn off your cameras while I do my presentation, and then we'll turn over to Dr. Dingle for the moderation. Okay. Let me find the share screen button, which I'm not seeing.
Catherine, it looks like we have somebody asking about subtitles or translation.
I don't have subtitles or translation. I'm sorry.
There is a tool at the bottom of the screen where the icons are. And if you look at where it says, where the little 3 dots are, there's where it says more, there's a little thing that says captions, and whoever wants to, I think that's a tool that whoever is watching in their computer, they can enable. It's not something that we can do.
I see it here.
So the question we are considering today is a profound spiritual and existential question most of us, unless we die suddenly, will all face about how to find peace in great suffering and at the end of life. Is it even possible? Our panelists will discuss this, and hopefully there will be time for questions. But first, I need to give you a very brief introduction to the World Day of Peace and to IAHPC, so you know something about who we are. So I suggest that we start, all of us, by taking a breath together and centering ourselves to focus on the topic. So each year, the International Day of Peace, IDP, is observed around the world on the 21st of December. The UN General Assembly has declared this as a day devoted to strengthening the ideals of peace through observing 24 hours of nonviolence and ceasefire. So let's just imagine that. Never has our world needed peace more. IHPC has never celebrated this World Day before, but we thought it was a good opportunity to highlight how palliative care and pastoral care can provide peace to people with serious health-related suffering. This year's theme for World Day of Peace, dictated by the UN, or decided by the UN, sorry, is actions for peace and our ambitions for the global goals, which is Agenda 2030. As I'm sure you know, Goal 3 of the Agenda 2030, Target 3.8 of the global goals is universal health coverage and access to medicines. Universal health coverage includes palliative care, and palliative care includes spiritual care. So there you have it. That's why we're celebrating International World Day of Peace today with a webinar on palliative care. So very briefly, IHPC is a global nonprofit membership organization whose vision is a world free from health-related suffering. Our mission is to serve as a global platform to inspire, inform, and empower individuals, governments, and organizations to increase access to and organize the practice, optimize, the practice of palliative care. So that is, oh, come on, where's the next slide? It's not moving. Okay, we are headquartered in Houston, Texas, although we all work remotely. I'm in New Mexico right now. We have individual and institutional members in more than 100 countries at the last count. This changes every day. Our 4 pillars of work are research, education, advocacy, and education. We are officially accredited with the United Nations agencies, including the World Health Organization, and we subsist on membership fees, small grants, and donations. We accept no money from industry, including the pharmaceutical industry, so we have no conflicts of interest. And we encourage you to join or to donate to support our work, and I'll have a slide at the end that shows you how to do that. Brief definition of palliative care. This is our consensus definition, which is built on the WHO definition. It's the active, holistic care of individuals across all ages with serious health-related suffering due to severe illness, and especially those near the end of life. It aims to improve the quality of life of patients, their families, and their caregivers. And the central ethic of palliative care and of our organization is the ethic of non-abandonment of patients and families. And of course, you can find out much more about that on our website. Few housekeeping issues. Please put questions in the chat. We'll try to answer in person or online, time permitting. A recording will be available and will be posted on the IHPC website. The YouTube channel and the website. And certificates of participation are not being offered for this webinar. So now I'm going to pass you on to our moderator for today, Dr. Dingle Spence, who will introduce the panelists. Dingle is a Jamaican physician with training in both clinical oncology and palliative medicine. She's the retired senior medical officer of the Hope Institute Hospital, Jamaica's only dedicated oncology and palliative care unit, and an associate lecturer at the University of the West Indies in Kingston, Jamaica. Dingle, you have the floor, and please let me know when you're ready for me to share the slide with the panelist names and affiliations. Thank you.
Okay, Thank you, Catherine. Good morning, everybody. Good afternoon, good evening. I know we have a global audience here with us today, and I'm really honored to be able to moderate this meeting with three wonderful panelists on this very special day, the International Day of Peace. So without further ado, Catherine, I would really appreciate you sharing your slides so that I can introduce our panelists. And I will just say there's a little bit of an error on my slide because I'm the current director of Jamaica Cancer Care and Research Institute, but I'm retired from the public sector where I spent 20 years running a hospital, oncology and palliative care focused. So let's look at the slide for introducing panelists, please.
Give me a minute. I've got to find that one.
Okay.
Going to end that one and get the other one. Here we go.
I think you need to make it a little bit smaller.
No, I know. Sorry, I've
Yeah.
got the wrong view on it. I'm going to stop the share and do it again. So, so basic share. Okay, here we go. Right, you got it?
Perfect. Thank you very much. So I'd like to start with welcoming and introducing Imam Mohammed Assad, MBE. Imam Assad is works in chaplaincy in many organizations in the UK. He's based in Birmingham and is a well-known imam in the Birmingham Central Mosque in the UK. He's a lecturer and a member of many he's a member of the Birmingham Faith Leaders Group. And I know that he received his MBE partly focused on the work that he did looking after people from all walks of life and all faiths during the COVID pandemic. And that was definitely something to do with relieving suffering. So we're very grateful to you, sir, for the work that you did during that time. Next, we have Father John Damascene Ruranga from Zambia. Welcome, Father. We know you joined us a little late with connectivity issues, but we're really glad to see you here. Father John is a chaplain at the St. Joseph's Hospice in Livingstone, Zambia. He's a hospital chaplain as well. He's an assistant pastor, and he would be a core member of the Livingstone palliative care team. And then I would also now like to welcome and introduce our third panelist. This is Professor Cristina Grisham-Montanes. She is currently in San Diego, so we know it's quite early morning there for you. Thank you for joining us. She is a hospice palliative care chaplain and works in the Hospice of the North Coast at the National University. She is affiliated with Global Partners in Care and has done quite a lot of work in Africa, including in Malawi. So we welcome everybody to this exciting gathering. And I'm going to start by posing the first question. We have two questions today. Each panelist will speak for about 5 minutes, and then we'll do a sum up, and then we'll move on to our second question. So the first question is peace in serious health-related suffering and at the end of life possible? And I'm going to ask Imam Assad if he would like to take the floor for about 5 minutes to speak about this question. Thank you very much.
Good afternoon from UK, good morning and good evening to other participants around the world. First of all, I'd like to say the greetings of Islam, peace be upon you all. It is very relevant to the day today as well. It is all about peace. I would just like to start off with an incident and then just fill in the gaps and talk about peace at end of life in suffering. It wasn't too long ago that I was called out to a patient, to see a patient in hospital who was told that he's only got 2-3 days left to live. So he was, as you can imagine, he was going through quite a bit of suffering, but at the same time, he was really scared that he's going to die in the next 2-3 days. And to make matters even worse, he did not have anybody around him. He had a wife who he hadn't spoken to for many years. He had a son who didn't acknowledge his father, so he wasn't in touch, and it wasn't a large family at all. So he had nobody. And what he was saying, that I'm really scared, I'm going to die. I wished I wasn't told, and I could have just passed away silently without me going through all this. As a Muslim chaplain, what we believe, I shared and reminded the reminders, and in short, it changed his thinking, his perspective, and there was a happy ending to it. The word or the words end of life do not really fit well with Islam or Muslims, because Muslims do not believe that this is the end of life. The word that is used in Arabic is intiqal, and intiqal means transition. So a Muslim believes that he's only in this worldly life for a short period of time. There is a life to come in the hereafter, and intiqal means transition from this worldly life into the life hereafter, which is never ending. The Muslims use the phrase Inna lillahi wa inna ilayhi raji'un. It is a verse of the Quran, and it is very soothing, and it brings so much peace. As soon as they hear about somebody passing away, anybody will just recite Inna lillahi wa inna ilayhi raji'un, which means that we belong to Allah and we are to return to Him. So it is not that it is the end of everything, but in actual fact, it is the beginning of many things. So coming back to the patient, some of the things that I shared and how we can get peace at this time, even though we see this visible suffering, I talked about how fortunate he is, because we are taught as a Muslim that as long as you are alive, whatever sins you have committed, you turn towards your God, you ask for forgiveness, He will forgive each and every single thing. So I talked about how it is a golden opportunity to connect to the Creator that you are about to go and see, that He is calling you back. So ask for forgiveness and call. Here's the phone. Then anybody that you might have hurt or thought that they might have been upset, call and ask for forgiveness. And so he did that, and it ended up him being united with his wife and his son that he hadn't spoken for many years, and asking forgiveness from God as well. Because Muslims, we see suffering as it can be seen as a gift from God. It is something that nobody asks for, and you shouldn't ask for illness. But when illness comes, we believe that it has come from God. It eradicates and washes away the sins. It elevates a person's status, and it brings you closer to God, because in illness, a person will be seeking God's help with patience and prayers. وَاسْتَعِينُوا بِالصَّبْرِ وَالصَّلَاةِ. A Muslim is instructed in Quran that seek God's help through patience and prayers. So it connects a person very closely to the Creator. And coming back to the question again, that there can be and there is peace in suffering at the time of death, because this is the transition. So just before you're going to meet your Creator, you can have your sins washed away and you can reconnect and get closer to God, because once a person takes his final breath in this world, it is the end of everything. So thank you so much for that.
Thank you very much, Imam. I've learnt an enormous amount just from you in those few minutes. So very grateful for that. I'm now going to turn to Professor Cristina Montanes to speak on the same question, and then we will follow that with Father John. So over to you, Professor Cristina.
Thank you so much. I agree with you, Imam. I learned so much in that short period, and I would like to also extend May peace be with you and may peace be upon you, and in my tradition as well, as we celebrate this International Day of Peace. I've been asked to speak with you about my work in hospice and palliative care that crosses a few different contexts. And really, I want to answer very directly this question: is peace possible in serious health-related suffering and end of life? And the short answer is yes, in my experience. And I'm going to share with you a couple of different stories that illustrate the types of contexts that I'm working in, and also to broaden the conversation to include those of us who are clinicians and working alongside patients, because a lot of what we do impacts those we serve and how we attend to ourselves and the state of peace that we're in. So the first story, I agree with Imam, we often find people who have received this diagnosis. It's shocking. They may not have time to process it all, and then end up in our care, in our hospice system. And I work within the context of the American hospice and palliative care system, and also globally in countries like Malawi, and most recently educating a group of wonderful healthcare workers and clinicians in the Kingdom of Lesotho. And so I want to start with the concept that illustrates something that the Pew Research Institute discovered when they started in 2007, really researching the landscape of religion in the American society. And they found that religiosity was diminishing while spirituality was increasing. And so there's a group of people now that are referred to as the nuns, N-O-N-E-S, not nuns, as in the Catholic context, but nuns, people who are not religiously affiliated. And so I often see people who fall in this category, who may have started and baptized in a certain religion, maybe Christian religion, as 63% of Americans remain affiliated with the Christian denomination. But more and more, I see a lot of religious diversity and or this group of nuns, as we call them. And they often present with, oh no, I don't want to see a chaplain. And what happens is, because of the beauty and diversity of the palliative care model, which is interdisciplinary in nature, is it takes a little bit of time to educate about what a chaplain is, the requirement of having a chaplain as part of the palliative care team, which the state of California is very innovative, one of the first states to recognize that it was a standalone discipline and so valuable. And so as we talk and get to know the family, it becomes very clear that the patient and family may be in some sort of distress. And so often the way that we operate and work is to work together as an interdisciplinary team and to assess the needs of patients from their point of view. And so this is really important as we tie it into the second question that we'll talk about. But I've had what I call my nuns that want to do their homework. And so I'll visit with them and we'll chat and we'll get to know each other, and we'll learn a little bit more about what their understanding is of their disease and the disease progression. And then we just talk simply about hopes and fears, sense of sources of meaning. And what happens is this beautiful process that unfolds. And when listening from a non-judgmental viewpoint, holding space for these difficult conversations, often existential in nature, and I would also say spiritual in nature, we learn about the reasons why people may not affiliate with a religion. And what happens is this beautiful process where we do homework. And so things like the need for reconciliation, or the need for forgiveness, or the need to take stock in one's life don't change. They are really important human needs, especially when faced with serious illness. And so having someone walk alongside, not necessarily presenting from one denomination for another, is helpful. And what I see people do is they end up doing, quote, their homework. That is their internal work that needs to happen as they sort out their lives. We engage in life review. We engage in identifying these beautiful sources of meaning that provide internal resources and strengths for them to get through this phase of their disease progression. And we sit with that. And what often happens is I see a return to some type of foundational religious experience. So that might be somebody saying, you know, I really would like a blessing. Could we do it from a perspective that somehow takes on those things that are sources of meaning for me? So we might take someone out into nature, if nature is something that provides a source of meaning, and make that happen, and let somebody sit and soak in the sun and feel that presence of peace. We may do something as a simple blessing of head, heart, and hands at the bedside, not necessarily under the auspices of a certain religion or tradition. What also happens sometimes is people do want to reconnect, and in which case we link to, you know, a Buddhist temple, we link to a mosque near our centers, we link to a Catholic priest that comes and visits at the parish center from the parish center that's local near us at our hospice. So when people experience that kind of non-judgmental listening and approach of sitting in compassionate presence, so many things happen that innately bring peace. When
Christina,
Mhm.
I need to cut you off.
Sure.
It's 5 minutes each, okay?
Okay.
All right, we'll get back to you, okay? Thank
Sure.
you.
Thank you very much, Christina. We're working in a tight time frame,
Sure.
but hopefully we can expand more when we get to question and answers as well. Thank you very much. Father John, I turn over to you now. And just to remind you, is it possible to find peace in serious related suffering and at the end of life? So the floor is yours. Thank you.
Thank you very much. Good evening here in Zambia, or late afternoon. Good afternoon, everybody. Good morning and good evening, depending on where you are. It's my pleasure to be with you. Sorry, I managed to connect late because I was also coming from our St. Joseph's Hospice, where we had an administration meeting. Now, technology sometimes does not follow time, or it may disappoint. Now, coming back to the question, I concur with Imam and Professor. Is peace in serious health-related suffering and at the end of life possible? Yes, it is possible, but it is not easy to achieve. First of all, it depends on the patient, because, you know, when we see people who are sick, we have ideas, best ideas. But when it is you, now you, or me, facing that situation, it's not as simple as it may seem to be. And so that person, again, depending on that spirituality, the spirituality of the person. Spirituality meaning quest for meaning, quest for purpose, depending on the religion of the person, depending on what the religion of the person teaches about suffering. All that can help the person, the patient, to start walking towards the peace, which is needed at the end of life. But definitely, we need to help that person. It's us, chaplains, family members, healthcare providers, and everyone who can really contribute, journey with that person towards the peace at the end of life. By the way, I agreed very much with the Imam who said it's not end of life. Maybe we can agree that we mean here end of this kind of life, but definitely there is a life which is following. He used the word transition. Us, we use passage. Christians, Catholics, we use the word passage into the other life. Life is not ended, but changed. Those are the words we use to comfort the people surrounding the patient. And so we who surround the patient, who must journey with him, we have a lot of a big homework to do. It all again starts with the information disclosure, information disclosure to the patient and to the relatives. Does he know or she know the condition? Does he or she know the prognosis? Do the family have the family members been informed by whoever is to inform, especially the healthcare providers, with a lot of counseling needed? Then in the process, we go with the pain management. Pain management in palliative care especially, we are talking about not only the physical pain, where we can use all sorts of methods. There is also the social pain. Are the relatives caring for that person? There is the spiritual pain. How does that person look at the Lord, the God, or the one or the being, super being in which or in whom that person believes? Then we must call upon reconciliation. And this is what I have been doing in my ministry. Asking, for example, to the patient, is there someone you feel you need to forgive? Is there someone you feel you should ask for forgiveness from? What about your God? For those who believe in God, but mostly we have here been dealing with those who believe in God. What about your God? I've seen patients who say, me, I'm being punished, and so my God cannot forgive me. We have tried again to say he's a merciful God, and that is his other name, the forgiver. Or why is God punishing me? Because I tried my best to live well in this life. Now he's punishing me. Why me? So we have to journey with that person, calling upon his spiritual or her spiritual resource. It's a resource, her faith, her beliefs, and being helped also not as an individual chaplain, by the faith to which that person belongs. Because we have a lot of church denominations here in Africa. Here in Zambia, there are many. Even some were created 2 weeks ago. And so it all depends on how that pastor is coming to help us so that they minister to the person they have been ministering to in the church. Then I have some examples to see that really peace is possible. Possible meaning not automatic, but possible. For example, my mother, she died in peace. When we observed her, she was praying. Then she said, I have seen your father. Have you seen your father? Where is he? Because he had died earlier, 2 years much earlier. Yeah, he's there. Where is my rosary? Give me my rosary. I want it in my hands. So she was looking calm. She took the rosary. She started having it in the hands. And when we discovered she had gone, then other patients who have demonstrated that despite maybe the denial at first, no, Father, don't come now to pray for me. I will tell you, they are not ready. They don't, death is a reality which is not easy to face. Even me recently, I was sick. But then I said, okay, let me get ready, because I was feeling my life was threatened, Let me get ready. Until the Lord said, it's not your time. And I know another patient who really died again in peace, communicating in the sense that first talking, she was strong enough to talk, to chat, then praying, then remembering to say, my brother, where he is there, please comfort him for me. And so also remember, so you could see the person is really moving somewhere towards somewhere and solemnly cooperating, actually inspiring us to believe that the person is not lost, but going to a better place. And so, coming back to the question,
Father,
is this possible? It is. Yes.
Thank you. Thank you, Father.
Wow, that's just so rich from everybody, and I really appreciate the contributions. I'm just going to try and summarize a little.
Everyone's cameras on.
Yeah,
Sorry.
Professor Christina, would you like to come back on? Thank you very much. So there's many themes here, I think, and Catherine, please keep time for me. So
Right.
stop me at 5 if I get that far. There's definitely themes and threads. So I think everybody has agreed that yes, peace at the end of life is possible. That would be my personal belief as well. I think one of the things that's very powerful that I'm hearing is, you know, that we're in transition, we're in passage, we're in human form. And I hope this is not heresy, but I like to think that we're spiritual beings in human form. And we come to learn, and then we do what we need to do, and then we transition or we passage into a more enduring and eternal form. And I think that whether you believe in the Muslim God, the Christian God, whether you're a nun, I think we can all connect to that central theme of, yes, we are spirit and we are in human form. So for me, that's indeed extremely comforting. The other thing that has shown up from everybody is this need for, and the importance of forgiveness, the importance of reconciliation, that we don't want to leave this life feeling like, you know, we've done wrong and we don't have the chance to ask to be forgiven, whether it's from the people that we did the wrong to, or whether it's the wrongs that we feel we did ourselves. But I think that healing, and I've seen that in my own practice, that pain, physical pain can endure, and you can't get rid of it with morphine. But when you can get to the spiritual and the forgiveness side, a lot of that falls away. So I also understand that it's very important that meaning, you know, what meaning did our life have? What meaning do we have as we get to the end of life? What you know, that can be in terms of achievements and profession and so on, but it can also be in terms of connection with other people. You know, I was a mother, a daughter, a sister, a good friend. So I think the meaning comes a lot from human relations, and not only from spiritual connection. I loved what you said, Professor Christina, about needing to provide that compassionate presence for people. I think that's one of the powerful things that we can do. I think as spiritual providers, where, you know, we use this term holding space a lot more nowadays, but I think that's what we're doing. We're bringing our presence. And one of the things that I find is that we ourselves need to be centered in our own spirituality. I think that's really important. It doesn't matter what it is, because we're all going to be different. And Father, you alluded to all the many different faiths that you see in your country, that we need to be centered as caregivers, pastoral caregivers, chaplains. Where's our center? Because if we are confused and not calm, we will not be able to bring that to the table. So I think the other thing that was important that came up for me was, and we see this in Jamaica, who is a chaplain? You know, a chaplain is somebody who can help elicit these hopes, these fears, these meaning, the connection to nature. And it frees people up from thinking, oh, that means I have to suddenly go back to the religion that I abandoned when I was 15 because it didn't make any sense anymore. The chaplain can come in from a different angle. Whether, yes, if they're asking for more religious connection, then the chaplain can provide that and connect people with their faith-based personnel. But I think it's very important that the chaplaincy recognizes basic meaning, basic spirituality, and starts there, and then can open the discussion to be more religious if that's appropriate. So I am reassured indeed that we can find peace at the end of life. There's many routes to it, but there does seem to be a central core that we are spirit. We can move and transition. And if we can really get that, I think that brings a lot of peace. And one other thing I'd like to say that we see very often in hospice and palliative care, which is not spoken about, is that your mother saw her deceased husband. Many of our people who are transitioning see people who have gone before them. And if we allow that conversation, that can be extremely comforting, because it's almost like, here's the hand from the other side coming now to take me over. So you're truly not alone. And I think that's also an extremely comforting experience. So I'll stop there.
Yeah.
Thank you very much.
Wow. Beautiful.
And Catherine, would you like to put up the second question? Okay, we're going to go in the reverse order this time. So we'll start with Father John, and then Christina, and then Imam Assad. So the second question is, what else can we do to integrate spiritual care for patients in serious illness and at the end of life? So Father John, over to you. And we'll turn off our cameras if we're not speaking.
Thank you so much. Yes, you see, in Zambia, for example, there is some good news that the Ministry of Health, government itself, is integrating palliative care into the healthcare system, where at the level of hospitals and clinics, the palliative care teams are very welcome, including the training of more and more members who provide palliative care. And so for us to do even better, we need more availability of the spiritual care providers. And please train the spiritual care providers. It's not anyone, that is now my context. It's not anyone who has created the church who has a way of approaching sickness, suffering, and death in a way that can comfort the patient. And not only the patient, the family members. Because when the family members see their patient, their relative going down health-wise, they also have some feelings and some perceptions. And so we need spiritual care providers within the palliative care team who are trained, who will help them think and accept the situation. Some churches would just pray for healing, miracles. Now you can't come and start praying for miracles. Yes, God can do anything at any time, but not at every time according to our human way of seeing someone who is in serious health-related suffering, or who is really towards the end of his life. Only God knows. But doctors come, some doctors have come to me openly to say the prognosis is not good. And so come in. So I have to be trained enough. Then the nursing care providing team should also welcome the spiritual care providers and the whole of the palliative care team, because there is food, nutrition, there is treating pain pharmacologically or different ways, there is counseling, the counseling kind of it. So the nurse and the doctor should feel they are not enough. Their services are not enough, because the human being is a complex, richness. And so we need to work together and appreciate one another's contribution. Then we need to share with the patient, and sometimes they can talk, sometimes they reach a level where they cannot talk, but they can hear. They cannot talk, but they can hear. So even at the end of life, people can hear. So whatever we say, they may hear. They can hear. So we have to be prudent. And so in a nutshell, in a summary form, I say, we must have more available health spiritual care providers, because like in my case, it's not only that I'm a chaplain. And so some patients might need me, but they don't find me. Again, when I'm tired or exhausted from the other social work activities, I may not play the role I'm supposed to play. So enough personnel, spiritual care, trained personnel, spiritual care, cooperation between the palliative care team or people, providers, and the nursing team in the hospital or in the clinic or even at home and their relatives, understanding the theology of death, pain, and suffering, and so to surround the patient because he is or she is at a critical moment of their life. So there are some conditions to be fulfilled if we want to achieve that peace. And a lot needs to be done. All in all, thank you, government of Zambia, for integrating palliative care into the healthcare system. Thank you.
Thank you very much, Father. I'm delighted to hear about that integration, and we'll touch on it further. But now I'm going to turn to Professor Cristina Montanes to talk about the second question. Thank you.
Father John, I'm so happy to hear about that integration as well. And it calls to mind what we've been working with our global partnership in Malawi, and also now as we work in Lesotho. But one of the things that I love about what you said, and I'll build on, is this idea of training. And so when I was thinking about this question, it was three things that came to mind for me. It was education, advocacy, actually four things, funding, and self-care. And self-care looks different for everybody. But one of the most important things that I've learned in our partnership is this need for continuing education, and also more trained, as Father John said, more trained spiritual care providers. And training for spiritual care providers is very unique. And I'll mention a skill that's really important in this work, and it's called bracketing. When we know and ground ourselves in our own spiritual traditions, like Dr. Dingle mentioned, it's really important because what it does is it helps us know thyself. And so as faith leaders or clinicians, even civil society members, knowing this important skill to be able to bracket what our knowledge is of spirituality at end of life and work within the worldview of another. That's a skill that really takes a lot of time to develop, and in training programs with chaplains and spiritual care providers, it's emphasized. So it is a unique skill set that becomes very important so that we can do, as Father John and Imam has said, work within different traditions when we have that foundation of how to do a basic spiritual assessment. And that's so important because we know that people are made up of their life experiences in addition to those messages that they heard throughout their life about what suffering means, the meaning of suffering. So education is very big. Advocacy, that integration of palliative care into our health systems, but also advocacy around what Dr. Dingle shared. What she does a lot of work around essential medicines. This is crucial for us all as members of the palliative care community, because so many people in the world are dying without them, and so that becomes something where we, as spiritual care providers who have an understanding of suffering on multiple dimensions, can really lend a voice and advocate around that and make a commitment to having patient-centric care that incorporates this idea of what total pain is and the dimensions of total pain being more than just physical pain. In addition to that, I would add self-care or community care. It's very important for us to be able to sustain this work as advocates and people who have this body of knowledge, whether academic, relational, also within the context of bedside care. If we are not grounded, like Dr. Dingle said, in our own spiritual traditions and our own ideas of what suffering is, it's very difficult for us to sustain ourselves in this work. And this is such an important field. We want people in this field for a long time. And in order to do that, we have to make sure that we're intentional about our interactions with patients. We're intentional about the systemic issues that are putting pressure on our ability to provide palliative care, which brings me to the next topic, which is funding. This is very critical to understand and develop some knowledge around, and this is a growing edge for me as well, about how funding works in these situations. So this idea of having palliative care integrated into healthcare systems is very important. But as we all know, the reality is that money only goes so far and the needs are so wide. And so developing relationships and strategic partnerships with civil society, with faith leaders, with church communities, with other organizations, with business, to understand that it's important for us to be able to sustain the work for the long haul, because one of the things that we know will inevitably happen to all of us is death and dying in that process. And so it really is a beautiful community activity to put into action. The last comment I'll say is some type of intentional practice, whether that's prayer, whether that's sitting in silence. I cannot emphasize enough the beauty and importance of silence and what that brings for us as we become reflective practitioners. I'm getting my goosebumps right now. The importance of that and sitting there and hearing what that internal message of spirit is and why it's fueling the work that we do can't be underestimated in my opinions. I'll stop there. I see Catherine.
Thank you very much, Prof. Christina. That's lovely. And we'll hand over now to conclude the second question to Imam Asad. Thank you.
Thank you so much. It's really wonderful listening to the other speakers from around the world, and totally different, yet totally the same perspective as well. I'd just like to share in these few moments and minutes just a bit about the work that is going on here in UK. Working as a chaplain, whenever we hear the word chaplain, it is not always death, dying, and end of life. I work as a chaplain in multiple settings. I work as a chaplain for all the 3 emergency services, blue light services. I work as a chaplain in universities, in hospital settings, in hospital, and many other places. So it can be something like somebody just wants to take something off the chest. Their coffee machine wasn't working in the morning, so they're having a bad day, right up to the other extreme that somebody's about to pass away. So it can include all sorts of things. So what we have here in UK, majority of the places, major organizations, educational places, hospital, hospice, we have the chaplaincy teams. But what is unique, and I think it'll be something similar in other parts of the world as well, but what we really do prize and treasure is the multi-faith chaplaincy teams. So you can be a faith leader, you can be an expert in your own faith, but having the expertise of working alongside people of other faith is unique itself. So I am really honored to be able to work in that kind of setting. And just hearing the honorable and respectful speakers speaking, for example, Father John mentioned about the rosary. We have something similar like that in Islam and Muslims. We call it a tasbih. Dr. Dingle mentioned again about the souls when they're departing, they're seeing others. So in Islam, we have that as well. When a person is moving away from this world to the hereafter, they go and meet all those that have passed away as well. So that is again something which is overlapping. And just a quick brief mention about what Professor Christina mentioned about the nuns. So can be a different way of looking at things, but during COVID, a lot of the work that we were doing in the multi-faith team, it could be any faith leader. And there were many people that did not really assign themselves to a formal religion, but when it came to prayers in critical care and many other places, they would reach out to any faith leader. Please pray for us, please remember us in your prayers. So regardless of whatever their prayers and who you're praying to, but that is the beauty of the multi-faith team, that being able to relate to people of other faith or none, because when it comes to prayer, spirituality, there are many things which overlap. So we have, wherever there is a chaplaincy team, majority of the places, or some places are still setting up, but majority of the places we have multi-faith settings, and there are many beauties about it. So we have something similar like the palliative care, which kicks in when a person is identified that he doesn't have long to live, and they sit down with the patient, with the families, and put a care plan together. And part of that is the spirituality, who's going to lead the funeral prayer, how do you want your last rites, etc., etc. So it is something really beautiful that we have. And then what we also do, and what is, I think, is really very much needed, is training for the staff members in hospitals and hospices, which is ongoing. We always have faith leaders coming in and delivering the workshops for staff members. And there are those volunteers in the community that will be affiliated to a place of worship. Somebody might not have any family member at all, so there are volunteers that will come out from a mosque or a place of worship and will go out and see this individual who needs the spiritual care, or it was part of the plan that they put together with the palliative care. There is also a need of raising awareness, so it is being done, but there is always a constant need for it. So whether it's raising awareness through road shows, through exhibitions, or literature in the hospital made available for family members or patients, so they know that what kind of facilities are available in the locality, who they can reach out to, and having them in the place of worship as well. And having the faith leaders talk about it, whether it's the sermon, the service, or making people aware in the community. And that is something I've got planned for next month. So with the local hospice, we're delivering a workshop in the mosque itself, so I'll be delivering it, and the hospice as well. And we've got health professionals that will come to the place of worship, and then they will have internal workshops in the hospitals as well. So thank you.
Thank you very much, everybody. Again, some lovely common themes. Prof. Christina, would you like to come back on camera for us? Great. Wow, such a rich discussion. So I'm hearing, again, many themes and threads, but the place I just want to start is acknowledging the total pain. Catherine, I think it would be better if we didn't have that. Thank you. So we can see everybody clearly.
I just want to remind people of the question, but yeah.
Oh, sorry. Okay, thank you. So the question was, what can we do to bring peace to the end of life and in serious health-relating suffering from the spiritual dimension? So there's one of the things is total pain, which we've all been raised in palliative care. And I want to make an absolute plug for, we can talk about spiritual care till the cows come home, as we say in English, but if you're not out of pain, it's going to be tough. So we have to make sure that our clients, our patients are comfortable, physically comfortable, and then we may be able to make space for attending to spiritual care, but I think that's going to be challenging if you are in agony. What I'm hearing is the importance of integrating chaplaincy into the team, and how important it is to have more spiritual providers and more trained spiritual providers. It sounds very, very important. You can't just kind of walk off the street and think, oh, I can be a chaplain. I think just as we train as physicians, chaplaincy training is really critical.
Yes.
And then the other thing, and I'm hearing that from all three of you, and I'm also hearing the importance of advocacy. And Imam, you're talking about advocacy, raising awareness that, we can talk about death and dying. I think through all cultures, in Jamaica, we have this thing that we say, if we're going to talk about death and dying, that means we're bringing it on ourselves. So nobody wants to talk about it, which of course is not at all healthy or helpful. So I think that raising awareness in the professional public, in the general public, across the spiritual dimensions is really critical. The other thing that really stood out for me is what Prof. Christina talked about, bracketing. And Imam mentioned his term was, I think, multi-faith chaplaincy, is that, you know, we need to be able to reach everybody, to connect with everybody, and to be able to set our own personal belief system aside. And I think that, you know, because to me, and I think most of us would accept, there's a common thread of spirituality that is different from religion. And I think that chaplaincy can tap into that in a way with using neutral language, with shifting the language towards the faith base of the persons that we're talking to and including. And that's obviously really important. And then, of course, the whole teamwork thing, you know, palliative care is purely about teamwork. And so I think sometimes we have to educate, and being a doctor myself, I know we have to educate doctors and nurses who may not have much experience of chaplaincy about the importance of chaplaincy, because otherwise it can just kind of fall off the end. It's like, oh, the chaplain, do we really need them? Is that an important? To me, certainly when we had a volunteer chaplain in my hospital, and unfortunately it was for a short period of time and she was a volunteer, she was the most important member of the team. Once I could get the pain under control, the chaplain was the next most important person. So I don't think that should be underestimated at all. Really, really important. And then just to finish, that, you know, feeding back into the self-care of ourselves, because if we don't have an intentional practice, if we don't care for ourselves, somebody, it's not an analogy I like, but somebody said to me, you know, if you don't keep your own axe sharp, nobody else is going to keep your axe sharp. So what is it that we need to do to keep our axes sharp so that we can be there for others in what is, you know, many people don't want to deal with this. Other members of the team may turn their heads, shy away, walk away. As chaplaincy, we're right, to me, in the core of spirit, in core of the most important work that we can do for people who are suffering. So I thank you all for speaking to that. And really, I've learned a lot just here in this hour. And I think now, Catherine, we could open the floor to some questions from our audience.
Yeah, unfortunately, people can't ask them live, so I'm going to feed them to you, Dingle. The first one is actually about medicinal plants. That was the first question that came in, so I think that one's directed to you, and then I will go through some of the other ones once you've answered that. Because the other ones will be basically for most of the other panelists, as we can see. So
can you
answer
just
that
read
one
the question for me? When you say medicinal plants, could you be a bit more specific or read the actual question? That'd be helpful.
Yeah, I'm trying to find it again. Yes, thank you for this opportunity. This is from Baiba Baika. I'm a death doula. I work with a lot of calming, relaxing medicinal plants like verbena, valerian, hops, lavender, etc. I use herbal waters as sprays. I use tinctures, teas, and oils. They really work in the world. There's a growing interest in medicinal plants for all kinds of health-related issues. Do you know any serious scientific or medical research on medicinal plants and life? Thank you.
Okay, thank you very much. I'm just going to ask our panelists to mute your microphones if you're not speaking. Father John, if you could mute, that would be really helpful. Thank you. Wow, that's a very big question. I am completely in the camp of what I would call integrative medicine. So I think, you know, we all come from, whether we live in the West, whether we live in Africa, whether we live, you know, in South America, either we or our own ancestors, close ancestors, have a lot of medicinal plants that people will often turn to in times of distress. And I think that it's very important to recognize that what we want to be able to do is support conventional therapies, conventional ways forward. And if there are medicinal plants that can help, you know, come into that space and help people either in physical, emotional, or spiritual realms, then I think that's really important. I think the most important thing is do no harm. Do we know what our herbs are? Do we know which ones are harmful? Do we know which ones are helpful? And that would be, you know, turning to the elders in that in those kind of communities. I'll say a little bit more about this later, but also just to say that in the West, now there's a resurgence in interest in psychedelic plant-based medicines for end-of-life distress, existential distress. And so that's another whole area of work that I'm particularly involved in. And I'll say a bit more about that later. But I do think that medicinal plants have a very important place to play in health-related suffering and end-of-life care.
Thank you, Dingle. You can hear me, my mic's on. Okay. The next question has to do with hope and peace. And it's not directed to any particular panelist, so you can just put your hand up or Dingle will select you to answer it. It's what's the really relationship between hope, because some people have hope, but it's not necessarily as the panelists defined it in the other presentations, hope for a passage or for a transition to a different kind of life, but hope for a cure. So if somebody can address this relationship between hope and cure, that would be, and peace, that would be really interesting. Thank you.
I would
So
love
I would like to just invite everybody to speak to that, because Father John also said something about that earlier. So Professor Christina, would you like to start there?
I was
Thank
going to
you.
defer to Father John and the Imam on that, but I could certainly add in. I'd like to answer Joan's question because it was something that I forgot to talk about in my short time, which is on children. So if Father John and Imam want to take this one, I'd be happy to cede my time.
Father John, would you like to speak to the challenges between hope and cure and the asking for a miracle and about healing? And what does that really mean?
All right, thank you very much. The question is not as simple as it may sound to be, because one mistake we can make as the palliative care providers is to speak as if we know it all, but when someone is sick, from his or her perspective, it is not easy to accept that. Definitely, we must keep the hope of recovering up to a certain level when we see we are not recovering. Even we pastors and chaplains, when we pray, we must show that there is a hope in the Almighty that is super being, the owner of life, depending on in whom one believes. So hope should be always there for, hope of recovery. But reality has it that people die. And some conditions normally lead to death. And so, even if we are praying for hope and praying with hope, we must somehow insinuate, depending on the condition of the patient, that if it's not the will of God, the will of the owner of life, the person will go. And not go to be lost, but go to the person. So hope is, to the Creator. Hope is not just to recover, but hope is also to be safe where one goes at the end of this earthly life, because he goes or she goes into a life which is eternal. That is, these are the few words I can say. Now, it's not easy for we chaplains to pray with that patient, to pray with those relatives. They want to hear that a miracle is ready to be done and the patient is going to recover. But definitely, we Christians, we say, if our Lord Jesus Christ himself died, he died to show us that even when we die, we are not lost. We will be with him, with our Creator. So it's not easy. That's why I was talking about it. Understanding of suffering, understanding of death, so that we may know how to play the role of bringing about that same hope and the peace of the person who is seriously sick. Just these few.
Thank you. Thank you very much. Imam, I'd love to hear your opinion on this topic. Thank you.
Thank you so much. Faith has two parts, fear and hope. So hope is a major part of faith itself. And losing hope is losing faith. So there are, as a Muslim, we can never lose hope in God. And there are many verses and many teachings that where God says that sometimes you are asking for something which is not good for you. You think it's better for you, but there is something else which is better for you. And vice versa. Sometimes you despise something, but that can be good for you. Now, when praying for hope, praying for cure, there's a serious ill person and everybody's praying for him, or he's praying or she's praying for herself as well. So what we are told that three things happen when a person asks for a prayer, asking for a cure. Three things can happen. One is that a person is asking for a cure, and if God knows that that cure will be better for that individual, that cure is given to that individual. Or the second thing that can happen, that God knows that if he or she got what they are asking for, then it could be end up as a big trouble for them. So a substitute is given to them. And the third thing is that that prayer is not answered immediately, but in exchange, they will be given reward on the day of judgment for it. And when they see the reward, they will cry out that, oh God, why did you accept any of my prayers in the world? Had you not, and had I been given this reward, that would have been much better for me. So as a Muslim, we believe that hope is really vital. We should ask for a cure. And God says in the Quran as well, then ask, and I am willing to give. But there are these three ways that it can be given, and we should never lose hope, because losing hope is losing faith, and that is why committing suicide is absolutely not allowed in Islam, because a person can lose total hope in order to commit suicide.
Oh, thank you very much. I love that, where, you know, that hope and faith are tied, and that that's beautiful, that, you know, and so acceptance is in there as well. And I think acceptance must be part of the faith, that, you know, what you hope for will be given to you. And sometimes that may be acceptance that, you know, you will not recover, but that you will transition, you know, to be with one's creator. So thank you for that. That's lovely. Catherine, trying to read questions there.
While Catherine's reading, I'll just jump in very quickly that we use a phrase that seems to help with this question, is that this is an opportunity for reimagining what hope means for you. And those opportunities that can come given this new information that you have. So that idea that hope means something different, and what you can do along with your family, your community, to reimagine what it looks like for the time that you have left on this earthly, in your earthly body. So that's something that sometimes helps when we're having these conversations and facilitating this discussion with patients and their families.
Yeah, I agree. Just helping people shift what they're hoping for. Not that easy, as Father John had said.
Not at all. It's a process.
Yeah. Okay, thank you.
Sorry, I was just reading the questions again, and one of the ones is about shifting between peace and anxiety, which seems to be having just been addressed by the panelists, since we now have quite a few questions. Christina, since you just took the floor, do you want to continue by answering Joan's question?
I would, and I have to. We had a short amount of time here, and I was remiss in my last question. I wanted to say one of the growing edges and areas where we as a whole community can learn and continue to learn is to meet the spiritual needs and understand the spiritual needs of children. And this is something that has become a very important topic in our partnership with our team in Nkoma, Malawi. And we support the pediatric ward there as well. And I have to say it's one of the most beautiful experiences of bidirectional learning that I've experienced in my career. And that was that when we traveled to Malawi and seen the palliative care census grow there quite large, now that they have a well-developed program, the needs of the children were becoming more and more pressing and present. So we were able to do a training on what it is to be a spiritual being and how that might look for children and the ways they express that. Also their own anticipatory grief and bereavement needs. And so bringing that training in and then learning what it looks like in the context of Malawi, as opposed to maybe where it was developed in the States or in Europe, was very important and a beautiful learning experience. And I do believe I have experienced this as a mother, as well as a hospice clinician. And maybe because I'm a hospice clinician, I have a child who's grown up in the hospice world and movement, but children are absolutely spiritual beings. And if we just stop, pause, and listen, we'll hear those messages. Those messages come in things like questions most of the time, wonderings. And I think it's such a beautiful posture to learn from the children to be able to engage in the world with this humble inquiry. But the other thing that we have to understand as well is that children process information differently, and they have a difficulty understanding the jargon we speak in medical land. And so making sure that we're learning and training ourselves and bringing in child development specialists to this movement of global hospice and palliative care to help us learn how to communicate with children and meet those needs is incredibly important. And so thank you, Joan, for your question. And I promised I would get it in, and I did. I hope I've addressed the question itself. And I would welcome any other comments, especially because we do have Imam and Father John who've worked in hospital settings as well. And Joan's question is saying, how do we communicate that they know that they're dying and told us of someone who has died, communicating with them? How do our panelists provide spiritual support for children to be at peace? And how much training is given on children in your settings? I can speak from the training that we've done in Malawi, but I would love to have you add on to that as well.
As it call upon us, even me, I can speak.
What was that?
Sorry, please go ahead, Father.
Yes, and actually the risk is that most of the times we forget palliative care for children. But I remember in our training we had here in Livingston, we also talked about the palliative care of children, because they have they also suffer in terms of total pain. All physically they suffer, definitely. They feel loved or unloved, even if, for example, when a nurse injects the child might feel the nurse hates him more, but they have also emotions. So the challenge is to attend to their needs, taking into account the children's emotions. The methods might be different to manage pain for the children. But definitely, and then when it comes to spirituality, it might not be easy. It's not easy to talk about what you share with the elderly people. But if we tell a child about God and about heaven and about it's not easy anyway. It's not easy. It remains a challenge. I don't go deep into that one, because I still have to discover a lot. Most of the times they call us for elders and not for children. That question is sending us into more research and more practice. Thank you.
Thank you, Father. Imam, would you like to comment here on the children?
Yes, thank you so much. One of the main difference, we do get called, as Father John mentioned, that majority of the time it's adults, males, females, whatever. And it's not often that you get called for a child, but it is a reality. And the major difference from an Islamic point of view and as an imam, one of the things that we would keep in mind is when a person reaches the age of puberty and becomes a teenager or an adult, they are responsible for each and every one of their actions. And we believe that there will be the day of judgment for them and they will be held accountable for whatever they do. But as a child, there is no accountability at all. They are innocent. So there is nothing for them that they need to seek forgiveness of any sins that they have committed. They are totally forgiven. So that would be a total different approach with children, that the word that's used in Arabic is masoom. They are totally innocent. So there's nothing asking them that, no, you need to ask for forgiveness or you will be held accountable or whatever. It is a total more loving approach and compassion that this is a reality that we're facing, but children do pass away, but there is a beautiful place for the children themselves. So that is one of the major differences and in the approach that we have.
Thank you. I think I know we could speak about this for a long time, but I do think we probably need to move on to the next question.
Yeah, I'm afraid it needs to be the last one so I can do my closing.
Okay,
but,
sure.
There was a question about, which was sort of answered in some of the presentations, but that cultures often, especially in the global south, shy away from too much pain control, or the ones that are still in the high income countries in the diaspora. But can there still be peace if there's uncontrolled pain, is the question, given, as we know, the fact that pain medicines are unavailable in more than 80% of the world. So if we want to answer that in the next 5 minutes, then I will have to close. And then we'll try to answer the other questions online or through email.
Okay, so I think 3 panelists, you have 1 minute each to talk about, you know, can we also have peace if you're still in severe pain at the end of life, which is a very challenging question. Okay. So Father, would you like to start? And we're going to time you for a minute and then we'll move on. Okay.
Yes. There was a theme as we celebrated the World Palliative Care and Hospice Day, which was saying, dying in pain. I'm referring to quote, but that theme was about not really allowing or fighting by all means to treat pain so that to manage pain so that the patient may die without pain. Why? Because it's very difficult to find peace when the pain is so severe. Let me just say that if a patient has to die in pain, we should also struggle so much with that very patient to try to manage pain until we have failed. Maybe the person will be dying. To me, they should not be alone, left to that pain. They should see at least that we are trying to treat that pain. Probably they will understand us and die when the time comes.
Thank you. Prof. Christina?
Yes, I've fortunately and fortunately had this experience quite a bit in my hospice career. And there's a sense of helplessness that sets in, I mean, from the clinical perspective. One of the things I will say that I've noticed, and perhaps Dr. Dingle, you could speak to this as well, physiologically, what happens is when we attend to these other areas of total pain, I've seen this phenomenon where less and less pain medication is needed because these other areas are attended to. So whether the physical manifestation of anxiety in the body lessens and that terminal agitation that one might experience seems to relax when these other areas of pain and well-being are attended to. But I have sat with many people who we as a team were unable to just fully get that, you know, beautiful, relaxed look of comfort that one sees when somebody's passing. And in which case the team, the word that comes to mind, surrenders into the process of being with that patient and gathering everything up we have in our stores of love to support them. And in that sense, I feel as though that's an act of peace and a gift that we can give.
Thank you. That's really lovely. Imam.
I cannot make a comment from a clinical or medical point of view, but as a chaplain, as an imam, yes, there is peace despite how severe the pain is, because when we compare it with the pain in the hereafter that potentially does exist, then this worldly pain would be nothing compared to that. So having a look at that, there would be still peace for that person at the end of life.
Okay, thank you. Catherine, I think we have 4 minutes left on my clock.
We do, but Dingle, did you want to address that as a physician? And then I will share my final slide.
Okay, just in 2 minutes, I agree with you, Christina. Whilst it is very incredibly challenging to not be able to get on top of that physical pain, if we can address some of those other things, indeed, we do see the physical pain lessen. I'm sure there's all sorts of biochemistry to that, which I'm not going to go into. But, you know, if we talk about total pain and then we can fix some of it, but not all of it, at least we're attending to the totality of the experience. And, you know, I'm grateful that we can view suffering in that way and that we can, you know, attend to various different aspects of it and improve the total pain, even though there may still be physical pain that we cannot completely eradicate. So I think if we continue with that model of total pain, what can we do to address everything? I think we will be able to lessen the pain, even if there are no seriously strong painkillers out there. So we do our best. So thank you for that. Catherine.
Yeah, what a wonderful way to end it. So I would like to thank the panelists and share my very last slide, which let's see, now I need to put it on presenter view and thank the audience for joining us today, as well as the panelists. This is the beginning, I think, as I said at my beginning, this is the first time we've actually done a webinar like this, and it just feels like it's such a rich discussion. I want to reiterate that we function really on a shoestring budget. We're a global organization. We receive no funding from the pharmaceutical industry, so we have no conflicts of interest. We rely on individual donations and memberships to support our global work. So please join us by logging onto the website, and you can see the link here, or you can take a picture of the QR code to join us or to donate. We offer many benefits to our members, including courses on advocacy. I have a 5-module course on how to do advocacy at the international and national level. Also by experts on pain and symptom management. Advanced and basic courses on pain and symptom management. And we are planning courses for next year on nursing, spiritual care, and caregiving. So I can't thank you enough on this International Day of Peace for addressing this topic. And the consensus seems to be that yes, peace at the end of life is possible, even in this world that is so full of conflict and violence. And that's a wonderful message of hope for all of us today. So thank you, and I'm going to close the webinar and have a wonderful rest of the day or evening, wherever you are.
And thank you all. Thank you, Dr. Dingle.
Thank you, panelists. Imam,
Thank you all. Thank you so much.
All right.
Thank you, Christina. Thank you.
Thank
Bye
you.
for now.
Thank you.